This is a brief overview of the St. Ambrose University Interprofessional Health Clinic for those students who were unable to make it to the presentation on Tuesday. This is Mike Putoff speaking. I'm a professor in the physical therapy department. I'm also the director of the physical therapy department. I'm one of the faculty members who has been working on this project for the last year, so I'm happy to talk a little bit about what's been happening with the clinic. In this slide you see the representatives from each of your programs. These are the individuals you can speak to learn more about the clinic and to find out how you can specifically be involved in the clinic. A few important points that I want to stress about the clinic as we get into this. First of all, this is meant to be an interprofessional clinic. We're specifically designing it that students have to work with each other in a team format. We're doing this because this is so vital to the future of healthcare and hopefully how healthcare will be practiced in the future. Second, this will be all student-led for the patient care. There will be faculty involved who will supervise, give feedback and guidance, but the care is really going to be provided by the students. We are going to serve an underserved population. As you can probably figure out, we could spend all of our clinic time treating faculty and staff and students and people all throughout the university who think they need rehab services or medical care, but instead we're going to focus on the underserved population, those individuals who may not have access to care or to insurance. We really want to focus on prevention and wellness. We don't want this to be a clinic where we just treat what's in front of us and have the person come back a week or 2 months later. We want to teach the patients how to prevent future things and how to focus on their overall wellness. So today's talk, we're going to talk more about how the students can get involved and how they can seek out leadership positions. This clinic is really building upon what we already do at St. Ambrose. The Speech Language Pathology Department, they have the Scottish Rite Speech Clinic, and this is something that's run out of their department. Also, they do some outreach at some local grade schools. And then the Occupational Therapy Department, they have the Assistive Technology Outreach Program, and this is something that their students and their faculty are already doing. So this clinic is building upon our tradition of having clinics and outreach programs where our students get to use their skills in a real-world setting. To give you a quick overview of what has been done so far, our work group began this project back in 2014 in the summertime. At this meeting, we really decided, at the series of meetings that we had, I should say, we decided we wanted to focus on interprofessional learning, the underserved population. There were a lot of ideas going back and forth, and this was really the beginning of the planning phase. What we ended up finding out that we spent a lot of time learning about each other's professions. We thought we understood what each other taught and what we did as professionals, but there was learning that went on, and that's the same type of learning that you as students will experience in the clinic. In the fall of 2014, we started moving things forward, pursuing some EMR documentation systems, thinking about HIPAA, debating about how the clinic should be structured, how students will be involved, and we started to reach out to get some preliminary approval from the university administration and move forward on this clinic. In the spring of 2015, we received this approval. We started reaching out to some community partners like Genesis and Unity Point and different advisory boards that we had. We wanted them to understand what we were doing, so they understood what our mission was, our vision for this clinic was, and also to have their support. We're not going to be able to treat every single patient at this clinic, and there's going to be times that we need to refer out to the community. The other thing we determined in the spring is that Monday evenings, this would be more of a medical day focus. So this would be for patients with more medical problems, and Tuesday would be our rehabilitation day. This summer, we worked really hard and tried to hammer out the specifics of each day. We also got to the point that we said, now it's time to pull in more students. Now's the time to involve the students more in the planning and the administration of the clinic. This fall, we started to do some fundraisers to generate some funds for the clinic. We hope to have some students selected who are excited to participate and willing to participate. We're going to start moving towards final approval from the St. Ambrose administration and then hopefully start seeing patients in November. As the clinic progresses into 2016, we'll grow the number of patients that we're seeing. We'll start seeking some external funding for the clinic, and then also start thinking about 2016-17, how we can line up students who will work in the clinic in the spring of 2016 for that upcoming academic year so they're ready to be involved at this time. Also, we plan on involving the nursing students at that point too. So that gives you an overview of how the clinic has come to this point. I want to take some time and tell you how the clinic will actually be run, or how we propose it'll be run, and with the understanding that as we get into this, it might change as we go and as we learn. We envision referrals coming from a variety of places. Some examples, as you see on the slide, some local churches, groups that work with immigrant populations, homeless shelters, work release programs, and also word of mouth. As some of the providers throughout town hear about this, we envision them referring some patients to us. How we envision a patient coming into the clinic: first, this potential patient will contact St. Ambrose University. We'll have a phone number set up. We'll have some staff that will do an initial screening on the phone. The staff will determine, are they meeting the definition of underserved? Are they a non-emergent patient, meaning do they not have something very life-threatening going on? If we need to get them to the ER, they need to be told that we can't treat them in the clinic. They need to go somewhere else and in a timely fashion. The complexity of the patient. There's some things we can handle and some things we can't. We'll determine through this initial phone screening if we feel like we can. We will focus on adult patients this first year, and then we'll determine whether they need to go to the medical clinic or the rehab clinic. At that point, the appointment would be scheduled, or they might be referred to another provider or resource in town. When we talk about an underserved population, this is what we consider underserved. The patient has no primary care provider, they can't afford insurance, or they've exhausted their insurance coverage, or they're unable to pay their insurance deductibles through their insurance plan and need some a pro bono care provided to them. At this point, we plan on taking the client's word of mouth. We're not going to ask for pay stubs or proof that they meet this underserved population. Rather, we'll rely on the patient to tell us they meet this definition. On Mondays, this will be the medical day. It will run like a medical clinic, run by the physician assistant students and directed by the faculty of that program. Social work will be involved to provide some assistance with mental health issues and also to help potential patients find community resources as needed. These are some of the diagnoses that they predict will come through the door on their Monday clinics. The Monday medical clinic will be held on the first floor of the Center for Health Sciences Education, and the format the physician assistant program will be using is that all patients will cycle through this clinic. On the rehab day, this will be Tuesdays. We're taking a little bit different approach. We're treating this as a volunteer opportunity. Students will volunteer to be a part of this, and at this point it won't be a required part of our curriculum. We will have rehabilitation teams on this day. So as you see on the slide, there will be 2 OTs, 2 PTs, and 1 to 2 speech-language pathology students on each team, and then there will be a faculty supervisor from each program on that team. And we will really be focused, as you see, on interprofessional management. This is how we envision the schedule going. So at 3 o'clock there will be a team meeting. During this team meeting there will be discussions about the patients who will be coming in that day, developing a game plan of who will see which patients, how they will be managed, and a back and forth discussion between the students from the different professions to determine the best approach at that point. We'll see patients from 3:30 to 5. That'll be a time for a single evaluation or 2 45-minute treatment sessions. As you noticed on that previous slide, we had a team of 5 to 6 students. So what we could see happening is that 2 or 3 students would be doing an evaluation, and at the same time, there might be the other 2 or 3 students actually treating another patient during that 3:30 to 5 o'clock time. From 5 to 5:30, there would be debriefing time for the students, also time for documentation, and then we'd repeat that cycle again at 5:30 to 7 with that debriefing time at 7 o'clock and be done by 7:30. This slide is really showing you about the meeting times, what we'll be doing during those meeting times. This will be where that decision goes about which student does what part of the evaluation or the treatment plan for the day. As I just touched on earlier, the evaluation will be done by 2 or 3 students. One will take the lead in that evaluation. Others will provide support as needed, and in the treatment session, 2 or 3 students might carry out the care plan for the patient. And then, of course, the debriefing will be built in. This is where we expect a lot of the learning to go on. Discussion between the students, discussion with the faculty members about what they learned, what they could have done better, and plans for the next treatment session. This will be held in the physical therapy and occupational therapy department clinics. Students and faculty will rotate through in 4-week cycles. So a team of students and a team of faculty will work together for 4 weeks and work on the clinic every week during that time. And then after that 4-week passes, a new team of faculty and a new team of students would take over that team, that management of those patients assigned to that team. We have these 4-week cycles right now planned around the academic breaks. So there are some 4-week cycles that will be done over 5 weeks around Thanksgiving or around spring break, but the responsibilities would be that students would work for 4 weeks in the clinic. There are opportunities for students to have patient care roles, but also non-patient care roles. If a student is getting involved in a patient care role, you'll see what they would be responsible for. They'd have to go through training for the clinic. This would be HIPAA training. This would be how to use the EMRs. They would be in the clinic for 4 Tuesdays in a row. There might be some work prior to the clinic day where they have to prepare for the patient. That could be looking up a new diagnosis, thinking about new exercises, designing educational tools. There might be time outside Tuesdays where you have to work with the faculty members to finalize your documentation, where the faculty member takes some time to review and you may need to go back and revise something or add something in based on that feedback. And there would also be the time that you would have to debrief the next team coming in to take over your patient load. So that would also be some other time you'd have to commit to the clinic. We do have some opportunities for students who want to get involved, but in non-patient care roles, and this could be things from helping us design examination and treatment processes, developing educational workshops, fundraising, also supporting the students who are treating patients, almost acting as a tech role in the clinic to help do those important roles in the clinic that sometimes those in patient care can't get to. We're right now debating the clinic name. Right now it's called the Interprofessional Health Clinic. We will probably do some sort of survey at some point to see if students or faculty have other ideas for the clinic, so keep that in mind. Benefits, a few benefits, as you see, we've touched on some of these, that you get consecutive patient exposure. Some student clinics out there, the students might just see patients for 1 or 2 times a whole semester, and those times are spread out. You get to see patients over a 4-week time period and get to see patients progress and work on the consistency of care. Interprofessional interactions, you get to do things with other students from other professions in a very applied manner. I think this is definitely an advantage, and going on to the next point, this is a unique clinical setting. There's not any other pro bono clinics set up exactly like this. Also, your standard clinic that you're going to end up working in at graduation is probably not set up like this. This is a newer model we're trying and giving you that unique clinical experience. And this is an opportunity to be a leader. This is a chance to be a leader in your department and also within the college. Some of the drawbacks. This is important that you think about the drawbacks too. You have extra work involved in the clinic, and this is not a paid position, obviously, and right now you're not getting academic credit for this. So this is something you're doing above and beyond. We think this will make you a better therapist, a better professional, but those are a little bit more intangible at this point. This is a brand new endeavor for the university, the Interprofessional Clinic. So there's likely going to be some mistakes we're making. We're going to have to figure some things out. This may not be a smooth running process the first time we go through this. So you're going to have to be able to adapt to that, and likely you experience some frustration with this. And finally, there's going to be times you have to deal with students in the other classes and other programs, and they don't understand what you do, and the faculty may not understand what your profession does, and that might be frustrating at times. But this is truly where the learning can take place. This is the reason why we're doing this clinic, so you have that opportunity. But that can be frustrating to some students and maybe a little bit harder to deal with, and you need to know that going into this. So next steps. If you're interested, you can complete a student application by next week, by September 8th. You can see your faculty member from your program who's in charge, who's the clinic liaison, to get that application. Don't be scared off by the word application. It should only take you about 5 or 10 minutes to complete. It's really just collecting your contact information, asking for a sentence or two of why you want to be in the clinic, and any kind of special talents or skills that you might have that would be beneficial to the clinic. For example, maybe you speak Spanish and that's a benefit, or maybe you've had experience in fundraising or marketing. That can be something that can really serve the clinic. You should indicate in the application whether you want to do patient care or whether you want to be on a task force, and you'll see that choice on the application form. So in closing, this is a little bit about the clinic, and we hope you found this to be beneficial and you'll consider being involved in this. I can tell you the faculty are very excited about this, the university is excited about this, and I think this will be a great new endeavor. So if you have any questions, please see your contact from your individual program as you see on this slide, and have a good day.